Thank you for joining me for this fully authentic, non-edited birthday video where I just wanted to hang out with some people I don't get to see very often and sharing what's been happening with me over the last few years and what I see ahead. Thanks for joining.
Happy birthday!
So thanks you guys for joining. I started to elaborate and then I forgot to hit the record button, but I was just talking about how challenging the last few years have been for me. Starting off with the divorce, which was really rough for me, of course. I mean, divorce is always rough, but that was like number 3, like, ugh. So we won't go into that. But then my dad passes away weeks later, and it was on my birthday that we had to call in hospice, which was rough. And, you know, thankfully for my best sister friend, Brenda, she was there, she's a PT, and she was present, and that was so helpful. But you know, weeks after that, my mom started having problems, and it was like a year of just, you know, really stress mode, you know, like chronic stress mode. And my mom, like, literally had a broken heart, right? Her mitral valve just tore spontaneously. They don't really know why. And, you know, think of that heart energy, you know, and she was two weeks in the hospital, and there was quite a while there that I was just really, you know, working hard just to stay on the rails, not off the rails, and visualizing my mom being well and helping her spirits. And it was just, I felt so divinely supported during that time from people in my life, and just everything that it was really great. But, you know, then fast forward, it's like, feels like the last 3 years have been a blur. And I know a lot of people have kind of felt that way. And a few days ago, as I was contemplating all of this, I had that voice. And you guys know what I mean by getting the voice, right? That you see some nods, you know, that divine sort of intuitive voice that said, you know, you should go online and talk with people about this, because just to share, because I'm just someone who likes to be open and likes to share. But I've been working so hard the last few years that I haven't had a lot of this kind of time to connect with people other than, you know, when they're on my table or working with me or something like that. And I love doing that, but it's a different type of connection, you know? So what ended up happening then after that period of time, like my mom kind of gets through that, I started having some pretty significant struggles just with business, you know? I mean, I started Essential Therapies 10 years ago this month, which seems amazing that it was 10 years ago, but 5 years ago, almost, well, yeah, it was 5 years during this time right now, I had to find a new place to be for Essential Therapies. And we were at a time where I had to decide, you know, do I build this business or do I scale back? And I just kept getting that vibe and that feeling that people need this. And so I really need to follow that intuitive voice and move forward. So I found this beautiful space. And if you've seen my space in Toledo, you know, we're very blessed with a beautiful space there. And it was so funny, like anytime people would come in, they would just be like, wow, it feels really good in here. And you know, there's just sort of a vibe there that was really great. And so we've been lucky to be in that space, but I've had some major challenges, you know. I mean, small business isn't easy, but small business touching people during COVID, like, what was I thinking, you know? Like, you know, but I wasn't thinking, I was feeling, and I was feeling into this desire and this dream that I had, that I needed to share certain things with people. And so just this week, as I was meeting with a new business advisor, I pulled up my old business plan, and, you know, 5 years ago, I was looking for some business capital to help me, which, you know, was, you have to go through all this stuff and these big business plans and everything. And I found the vision that I wrote 5 years ago. Now, you would think vision is something you should read every month, or at least every few months, right? Well, I didn't do that. I was just trying to stay alive in my business and keep things going. But when I came upon this the other day, I was like, wow. And I'm going to read it for you because it's so relevant right now still that it just gave me goosebumps when I read it. So you guys gotta give me a thumbs up. You ready to hear this? Okay, so here we go. Vision 2020. Create a world where people know how to care for their mind, body, and spirit through understanding of the myofascial consciousness system and its connection to the physical and energetic bodies, thereby creating youthful movement, lasting function, and pain-free, fulfilled living. And I thought, wow, yep, that's it. Like, that's what I want. Like, who doesn't want pain-free living, right? And to be able to have lasting function and youthful movement. And, you know, as this is a birthday for me, I was thinking how I hear this all the time, especially as people are getting older. It's like, oh, it's my birthday, you know? And I don't know, about 10 years ago, I think it occurred to me that I'm younger than I'm ever going to be. So you darn well better appreciate that and hang on to it and love it, you know? And so I've been doing that really, really well, I think, since then. But I've also realized with what I've learned with working with patients and people who are in their bodies, but not knowing that they can really be even more in their bodies, like they're struggling with their body, the movement is difficult, maybe they have pain, whatever it is, they just kind of assume, well, I'm getting older. And so it's supposed to be that way, right? How many times have we heard that? Like, this is what people think. It's like, I'm supposed to decline, I'm getting older. And I like to say, no, that's not the case, because there's always room for improvement within. And it starts with the mind. And so if we can learn to connect through that system and see what we can do to optimize our body, I have yet to meet someone, even all the athletes that I know, who couldn't probably do something to make their physical, emotional, mental, spirit life and body better. You know what I mean? Like, don't we all feel, and including myself, like I'm always working towards that. So my vision with Essential Therapies is still the same, you know? And what I've realized, though, over these past 3 years is that I've not done as much as I could do and as much as I would like to do, even though I've been working so hard. And I feel the struggle. I've felt the struggle these last few years. And what I know is that I need a better system, you know, I need a better strategy, and I need to share smarter, not harder. So I kind of wanted to say that in a big forum to say, you know, hold me to this. And it's my promise to those people who want to have a life where they are moving better, they're moving more freely, they have less pain, and they're more connected, and they're able to ultimately love more from within. What I've been able to learn, which has been through a lot of pain and a lot of times, I want to be able to share that with you. And I want to be able to share that with more people, and with people that I have no idea who they are, but maybe people who you know. And I just kept getting all kinds of confirmation about this today. So just today, even, I had somebody call me who was actually my plumber before. And he's like, hey, Cindy, I'm just wondering, I'm having a really hard time moving, and I'm wondering if maybe you could help me with that. He doesn't know anything about what I do, but he remembers when he worked with me, you know, my plumbing, I don't know, several years ago, that I was into something that might help him. And so we made that connection, and that confirmed that one of the things that I'm going to start doing this year, which I'm going to share with you in a minute, he would fit into that group perfectly. And then I got another phone call from a woman in Florida who, and this was an awesome confirmation because she found my videos. This is such a cool thing. She's going to a physical therapist that she looked him up on the internet, and he said something about John Barnes. He's not a huge John Barnes person, but she saw that name and it intrigued her. So she searched that, and through that, she found my YouTube channel and some interviews with John. And that encouraged her, so she thought she would reach out, and she got a hold of Taylor, and Taylor got a hold of me, and I got talking with her, and oh my goodness, she's been through just the ringer with the medical system. She's got this horrible pain, and she went to this therapist who didn't really understand what would help her well. And so anyway, we connected, and then I was able to get the name of another therapist down near her, and I made that whole connection for her, so she's able to get treated on Monday. Like, how cool is that? And to me, that's that confirmation from the divine that you're doing the right thing, So that was just like, another, okay, keep going, Cindy, keep sharing. So with that, I want to say part of the reason why I haven't is, this has been a thing my whole life. I never, growing up, is it okay to say never? Yeah, pretty much probably never did I feel like I knew enough. And no matter how much I learned, no matter how many classes I took or degrees I had, I just felt like there was still too much to learn. And how could I ever learn enough to be able to really get out there and share? Because I've always been aware of this saying, when you don't know what you don't know, you can get in a lot of trouble, or you can cause somebody pain, right? Because I see it all the time. I see patients come in who've been to medical providers who don't know about the fascial system like I do, and so they've actually caused problems for that person. And that person has experienced things that they wouldn't have had to go through had someone else known this. So then I'm aware, well, geez, what do I not know about? There's so much. And so that's been a reason for me to not share very much. But I feel like this year, it occurred to me that I'm 59 today, so today is the first day of my 60th year, right? And I think about, I've been a PT almost 30 years. So these last 30 years and the things that I've gone through over these 30 years are very unique and specific when I think about the 30 years before that, And so you start putting this all together, and that's stuff that I think is pretty cool to kind of look at. And I wanted to share with you. Okay, I wrote notes so I wouldn't forget. I've got a few things that I wanted to share that's happened with me over the last 30 years, because even though I know there's a lot of stuff out there that I'm unaware of, and I'm asking for guidance and learning and finding out, I've learned a lot through these things that have happened in my life. When I look back into my 20s, I got into running, and I loved it, and I just went crazy with running. And before you knew it, I was running long distance, and I was at the time also teaching aerobics and lifting weights and doing all this stuff in exercise physiology. But I ended up with some significant running injuries that kind of grounded me. Well, I had really kind of relied on running to deal with my stress and even my emotions. I was kind of running away from a lot of it, to be honest. And you learn as a runner, especially with distance, to kind of shut off the screaming in the body. I mean, you're on mile 22 and your body's screaming and you're still going. So what are you doing? You're getting really good at tuning it out. And so I did that. And I experienced then injuries all over my body, in my feet and my hips, and a stress fracture, and so many different things. So it was really rough when I couldn't run anymore. So I went through all of that. And then I had just body pains kind of all over. Moving forward, I then had some significant infertility issues. So I struggled through all of that. And then when I was successful with IVF, I ended up being in the hospital for almost 3 months. And I know a lot of people don't know that about me, but I was literally grounded in bed for most of that time. Yeah, Linda, you're waving. You remember that era? Yeah. That was rough. So, I'd moved to California, and so I had no friends or family near me to come visit or anything. So here I was in the hospital during all that time with placenta previa, and this was after I was life flighted to the hospital. But I got through all of that, and then fast forward after that, I had problems with the scarring from my C-section and pain from that. I had foot problems, hip pain, back pain, shoulder pain, all these different things through my life that I learned to welcome because it gave me a perspective that I knew my patients were also dealing with. So that has been a helpful thing, actually. And then 2 years ago now, I can't believe it's been 2 years, I was in a cycling accident, which some of you might remember is more recent. And I actually brought my little skull. Let me grab that, because I wanted to share with you what was pretty significant about that. So I'll show that in a minute. But all of these things, what helped me was early on, this was after my running stuff, but when I became a physical therapist and I started to really do this myofascial work, I went and got intensive treatment in Sedona with John Barnes. And I had already kind of played around with this mindset training a little bit. I had a couple of books, but he told me, I for about a year and a half, I couldn't run, I couldn't do any kind of triathlon training or anything like that. I was just, barely, even walking was problematic. And he said to me, what is it that you would like to be able to do? And I knew right away that I wanted to do a little triathlon. If I could do even a short triathlon, which I wasn't really fond of doing, but if I could do even the short one, that would mean I could do all these other things that I hadn't been able to do. And so he encouraged me to imagine, just through my mind, visualize myself doing that activity, and focusing on the feeling of joy that I would have by doing it, and to incorporate as many senses that I could, like vision and hearing and the smell and the feel, all of these things. And so I really focused on that. And 3 months later, I was doing a triathlon again, which was kind of mind blowing. And my headaches were gone, and it was quite amazing. So that, I mentioned that because all of these other things, like when I was in the hospital with Connor, that visualization, not allowing myself to visualize anything except for the joy of the success of that being okay. Even when my mom was sick, the same thing. All of these things, and it's so important because we are really frequency beings, and our thoughts create how our body follows. And so this has been so paramount for me that I really want to be able to share more of this with everyone. And I carry it through to my self-treatment and my self-care. And I just think it's so very important. And I guess part of the reason why I haven't talked a lot about it in the past is, as a PT, especially in the medical system, the healthcare system, we don't talk about that kind of stuff. We don't talk about emotions. You're talking about the body part. And I'm deciding to not hide that anymore. So you may have seen, if you follow my podcast, I'm talking a lot about the emotions in the body and bringing that all into it in this mindset thing that I've been using for years, and also carrying that through to all of the other personal development programs that have been a huge part of my life. And not only did that start with John Barnes and those types of myofascial mindset, I call it, ideals, but being present and feeling in our body, but several things since then, which I'm going to start sharing more with everyone. My Peter Sage training, which is a huge transformational journey I started 3 years ago when all of this hit the fan. Exactly 3 years ago, it was actually 2 days before my dad died, I started my Peter Sage training, and that lasted 6 months. It was called the Elite Mentorship Forum, and I actually became a trainer to be able to share these things to other people as well. I just have been too busy to actually do it. So I've started that training again just a couple of weeks ago. So I'm super excited to bring that fresh into my mind. And also the things that I've learned from a local teacher, Dr. Galdal Kaba. She has been a huge part of my life, again, helping me with this whole understanding of awareness and being present and our mindset and visualizing what it is we want and feeling that joy. So I'm kind of going on and on here, but let me just make sure that I said all the things that I wanted to. Okay, so with that, all of that being said, I kind of wanted to come on here and make a commitment, because I feel that there's energy and power behind stating something that you're going to do, and also asking for your help to visualize me being successful in this. And I have started 2 books that kind of tie into each other but have very unique and different themes. So, and I'm not going to say the title or anything about it now, but I have another one kind of in the hopper, which will be more about my experiences with infertility, actually, and what I went through in the hospital and so on. But these books will help with people learning how to be present in their body and help to take care of their body and really tie into that vision that I read at the beginning. And then also something I wanted to share that I haven't talked much about, because in my 20s, I was really big into being a vegetarian. And I mean, even when I was little, Mom will nod her head on this one, I hated eating meat. Remember, Mom? I would just be like, ugh, God, I hated meat. And I just, the idea of eating animals, like there was no way. And I couldn't wait till I was in my 20s, and I was so sick of my mom trying to get me to eat meat that I'm like, I'm a vegetarian now. And I really went into it, like 8 years I was a vegetarian. But you know what? I didn't feel well. I wasn't doing well at all. And so I came across a book called Protein Power, and having had graduate level biochemistry and having lots of questions in that class, I was like, wow, I think I need to not be a vegetarian. So fast forward another 20 some years, and last January, after researching this for quite a while, I decided to give carnivore a try. And what does that mean? Carnivore is basically eating animal products for the most part. So yes, I have dairy, and the funny thing is I couldn't even tolerate dairy before when I was a vegetarian, but I eat meat, and a lot of times I eat just meat and eggs and butter, and I feel so much better. It's insane. I've had so many gut problems my whole life that when I started eating this way last January, I was blown away. And I haven't told many people about it because it's like, talk about a belief system change, it was like turned my life upside down. But when I started meeting people from all over the world, and Kim is on here, you can wave, Kim. I met Kim in the carnivore community. It was mind-blowing to me to see how people have gotten rid of their inflammation. They've stopped autoimmune diseases. I mean, all kinds of autoimmune diseases, reverse diabetes, improved their heart markers, and just so many different things. And so I have really dove into learning my metabolism and measuring my blood multiple times. I go through in spurts of it, and also my ketones and my glucose and all of these things. So as I go through this journey, and I just signed up for some coaching courses through Professor Tim Noakes out of Australia, Southern Africa, who it used to be the carb guy. Actually, he was the runner. He's an exercise physiologist. So that was my first love, right? Exercise physiology. He was the carb loading guy. Okay, he wrote the books on carb loading. He ends up with diabetes. Long story short, now he's teaching about keto diets and carnivore. So that's something I'm going to be sharing more about during this next year ahead. And then also this Elite Mentorship Forum, this personal transformation program that I'm involved in, and just sharing really solid advice about how to stay centered. I mean, that's pretty much what we are doing in myofascial release, right? We're learning how to connect to the body and how to promote a positive mindset and so much more, but realizing that we can actually affect that. And when I fell on the cycling accident 2 years ago, I really used these principles. I also used the principles of cold water exposure, right? Because I've used that the last 3 years as well. Thank God for that. That really helped me through a lot of the stressful stuff. But when you look at this skull, what happened to me when I landed, this bone right here with all these teeth in it, this bone was crashed. I hit right here on the concrete. This bone was smashed inward toward the center of my head, so that this front right tooth was directly behind my left front tooth. And so that meant this whole entire bone, right, was pressed behind there. Well, along with that, look at everything else, okay? So what else is here? We have all these cranial bones, and then this is called the mandible. It is the jawbone. And the TMJ goes from one side to the other, temporomandibular joint. And so when you smash this, where this joint connects, it's going to throw it all off, right? So when I landed, I kind of lost my consciousness, I believe, there for a moment, because part of it, I don't really know what happened. The next thing I know, I'm waking up on the ground, and I can't breathe. The wind was knocked out of me pretty significantly. So I was like, I couldn't let air in or out for a while. And I thought, okay, well, this is what it feels like when you crush your face on the ground, which is basically what I would say to myself when I would get in the ice cold water, right? All winter, okay, this is what ice water feels like, and my body can handle it. I'm okay. And then I would go into this calming state that I learned from these trainings that I've had. And I would be okay. I would connect in with my body, do an assessment of how everything was doing, and then I would tell my body kind of that I was okay. That's what I did when I crashed my face on the ground. And I truly believe that my mindset of guiding my face to do what I know I needed it to do is mostly what helped me. I mean, yes, I knew what to do with my hands, but it was this, I didn't let myself freak out. I mean, I felt what was going on, but I thought to myself, this is what this feels like. Okay, the power that smashed into my face moved my bone. Well, I know I can move that back. And I just believed it from a place deep in my heart, and then I just kept working. So of course I went to put my hands in my mouth. I couldn't open my mouth because this was all skewed. And then I immediately started to work on my jaw, enough to move the jaw over enough so that I could put my fingers in my mouth and start working. And of course, over the next half an hour, the emergency came. They took me to the ER and the ambulance and on and on. And during that time when I was in the ER, I was able to actually heard and felt a pop of that bone going back. So I was gradually feeling my tooth move over, move over, move over, move over. And then it kind of got here and then pop, and it hurt like crazy. I screamed. The nurse thought she pulled my hair. It was kind of funny. I wasn't telling them what I was doing. God only knows what they thought I was doing. And it was amazing. Well, right after that, about, 3 to 5 minutes, I had a seizure. So they are, of course, freaking out because, oh my God, here's this woman who had a head trauma. She's having a seizure. They're taking me to the CT scan. I woke up from the seizure because I thought I just passed out. I'm like, oh no, honey, you didn't pass out. You had a seizure. I'm like, okay, that's interesting. And then I'm kind of thinking, wow, well, that makes sense because what's in here, right? All the stuff in your brain, it was jolted big time. And then I moved it back, so it was jolted again. So yeah, like everything kind of went wonky for a minute and kind of needed a reboot. And I believe that's what the seizure was. Of course, they life flighted me again. So twice in my life I've been life flighted for, emergency reasons. And ended up being okay after watching me for 24 hours and doing more testing and everything else. And I'm like, look, I got to get out of here. At least it gave me time to continue to work on myself. So basically, what I truly believe is that our mindset and our thoughts create frequency and energy that is our consciousness, which flows through the fascia of our body, connecting every single cell. And it is absolutely pliable and responds to command central, which is what we decide in our conscious mind to create to a point. I mean, some things, of course, we can't do, but a lot we can. And if we allow ourselves to go down this like, oh no, scary, expecting the worst type mindset, the body doesn't know any different but to follow that. So this is what I've been spending a lot of time learning about and practicing in the work that I do, but especially in the work that I do in my own body. And my experience with self-treatment and self-care since that accident, and especially over the last 3 years in general, has really catapulted. And I want to be able to share that with you and other people, because I do believe that many people are not experiencing the life that they would like to because they're physically limited. And it doesn't need to be that way, but it's just that we don't know. In medicine, we're not aware of this. It's just coming out more and more. You'll be seeing about it, and I want to be able to share that with you. So I would love to show you a few techniques for the head, and then if anybody wants to join me at the wall, my favorite routine is legs up the wall, but I would love to take some questions or comments or thoughts, because that's kind of all I have to say, I think, right now. Anybody want to unmute and share anything with me? What do you think?
Rational thinking is what helps you out a whole lot. I can do it.
Yeah. Cool. What, Mom? Hang on, Mom. Let me unmute you. I'm going to ask John. You're going to see a button. It's going to say unmute.
Mom on there?
You there, Mom? There you
There
are, Mom.
she is.
That Linda?
That's me.
Hi, Linda. Wasn't that great?
Yes, it was, Carolyn. Hi, sweetie.
Happy birthday day to my mom.
Yeah.
Happy birthday day, yes. And happy birthday to you, Cindy.
Thank you.
Cindy, that just is such an awesome testimony. I remember when that accident happened.
Mm-hmm.
It was unbelievable. You were in care flight working on your face. And I thought, only Cindy. But that has stuck with me as one of, I just call it the miracles of MFR, of being mindful, as you say, and believing in what you're doing. I had a bit of that experience when Mama fell from her chair and she broke her tibia and fibula. And I knew she wouldn't make it if we took her to the hospital. It just wasn't going to happen because they would have been compelled to do surgery and so on and so forth. And I knew her best chance was to be at home. And I recalled from the Mutant Messenger Down Under. It's a work of fiction, but I think it's truly based on a true story of a lady that went walkabout with the Aborigines, and they demonstrated their healing technique for a broken leg. One of the tribesmen broke his leg, and everyone in the tribe took turns holding his leg, singing to his leg, stroking the energy body of his leg, that energy template, to get that to come back, into a calm place. And then his leg just mended. It didn't take 6 weeks and casting and this and that and the other. And I did that with Mama. I first stroked her energy body while Dawn was working on her heart because of the shock. And 1 month to the day that she broke it, I was just doing a very simple foot. I won't even call it an unwinding. I was just holding her foot and it started to unwind. And then I heard this tiny and felt this tiny, like it wasn't even a pop. It was just like a dut dut. And her leg, which had formed that collagenous sticky substance, just went into perfect alignment. It had been mostly aligned, but not perfect. And I'll be darned if it didn't go into perfect alignment. And I have pictures of the before and the after. So I'm on the phone, Don. Sorry, sweetheart. But anyhow, I've experienced that miracle of the belief because I really believed that her body could heal that and that she could live through what was a really catastrophic shock. It was really a terrible shock. She was 100. So I so am grateful for you sharing your experience because that just makes that belief even stronger for me. So thank you so much for that. And I love what you're doing. I love your videos. I share your videos. Oh, I'm so grateful for them. I'm always sharing, the legs up the wall and the ball and the different stretches, and clients love them. So you're very popular down in this neck of the woods.
That's awesome. Thank you, Drew.
Yeah.
Yes. Oh, your mom, for those of you who don't know, Drew, her mom was such a happy, happy person, right? And I never saw her personally, but you shared a lot on Facebook, and she was 101. Is that right? Did she make it to 100?
2,
102. Wow.
102, yeah.
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 Was she,
But happy, what?
was she ever able to walk again after she healed?
Yes. She
Wow.
was able to weight bear 1 month from the day that she broke her leg. And in fact, I did take her to get an air cast. I took her to the ortho. I didn't know if they would want to put a cast on or an air cast or something a couple weeks after when everything was kind of stabilized. Um, and they ordered an air cast for her. And I went to Centerville to pick it up, and she didn't need it anymore. I had a follow-up visit, and the ortho said she doesn't need it. It's healed.
Wow.
So yeah, there you go. The power of intention and thought. Yeah. So happy birthday, lady.
Thank you. Thank you so much.
You're
Speaking
welcome.
of the thought piece, and Bruce Lipton. If you guys don't know who Bruce Lipton is, he's a doctor who discovered stem cells. So there's a lot out there about Bruce Lipton, right? And he wrote a book called Biology of Belief, and talks a lot about how most of what we do throughout a day is running on our subconscious program, right? It's that patterning that is just kind of always running. And if we want to change that subconscious programming, we have to make a conscious effort to do it. And I think that's really the key there, is to be intentional. I've been using this lately, to have attention to your body. For example, when I'm doing my self-treatment and I'm connected in there, have attention to that area, but also intention, right? So that our intention is that conscious thought that is giving our body, mind, an opportunity to do something specific and new or different, which is what I was doing in my mouth. I had the intention that I needed to get this, boom, back to where it needed to go. And I kept my attention there, which was difficult, right? It's hard to stay focused sometimes because we can let, our thoughts go. But I just kept staying. In fact, when it first happened, I'm laying there on the ground, like I was hearing everybody around me, but I wasn't engaging in any of that. I was staying engaged with attention on my body. But yeah, that taught me a lot. So that reminds me, one of the things I was going to share is there's two groups that I'm starting in the next. So you might be interested yourself. You might know someone who might be. I'm going to be putting together two myofascial coaching programs, which will be virtual, so you don't have to be in person with me. But it'll be focusing on head, neck, and jaw. But of course, as we know in MFR, we're doing things throughout the whole body. But I mean, what I was able to change in my head was just mind-blowing to me. And I've been able to teach a lot of my patients a little bit here and there. But what I feel it needs is a consistent thing, like every day of the week, right? So what this program is going to be, and I'm only going to take like 10 people initially because I'm kind of creating a beta program, beginning program, where you'll be in touch with me every day. Virtually in some way. There will be 2 times a week where we meet virtually like this and we actually do the techniques together. And then there will also be a couple of times where I'm just one-on-one working with the participant as well. And there will be in back and forth during a 6-week period, which sounds like a long time, but I worked on my mouth after that happened for so long. I mean, basically all summer. I was working on things. It wasn't until September, so that happened in May. And late September, I was actually able to bite into an apple for the first time. So, it took a lot of intention and a lot of time and focus to be able to get things back. Every morning I would wake up and I wouldn't be able to open my mouth more than this much. So I would spend about 25, 30 minutes to to work on that and get it to where my mouth would open. And then I could do, more things. So yeah, it was consistent. So I learned a lot during that time, and I've worked with so many people with headaches, and I had horrible migraine headaches years ago, and so much of it is related to this. So that's the one thing. And then the other program is for people who are just wanting general self-care, total body, especially if they have decreased function, like difficulty, like even someone getting to the floor is difficult, right? Getting to the floor and back up. So I know for a lot of people, when I talk about legs up the wall, they have resistance to doing it because they have to get to the floor, right? And it's hard to be able to do that for some people. Well, if that's the case, there are things that we can do to help you strengthen again, or you might need even some myofascial type self-treatment in a different position to help you relieve that tension in your body so that your muscles will work better. Because what most people don't know is that, in fact, this was the conversation I had with a gentleman this morning who reached out to me. He's so weak he can hardly walk now. And this guy's fairly young. I mean, I don't even think he's 70. And his body is so tight that he can't get his muscles to do what he would like his muscles to do. So you can't just strengthen someone like that. We have to remove that straitjacket that's on their body first, or loosen it to a point where then the muscles will begin to work again. And then we can start with baby steps from there. And a lot of times people, I hear this a lot, oh, you got to strengthen. Well, that might not be the case. And so as an exercise physiologist, believe me, that was always my thing too, until I realized, wait a minute, we can't strengthen a muscle that is stuck in a straitjacket. And it's not just the muscle that we focus on, it's everything else, right? And it might be somewhere else in the body where it's hung up. So yeah, there's so much there to consider. So I'm going to be looking for people who are interested in that. If you are interested or know someone who might be, I'm going to be putting that together in a way that I can help more people be able to be successful with that. And a few more people pop on here. Thank you guys for showing up. Gosh, we've been talking for a while. Is anybody interested in some cranial techniques? I think I should show that first, and then I would love to do legs up the wall. For anyone who wants to stick around. But are there any people here who get headaches?
Cindy, before you go, yeah. How much are you going to be charging for that 10-person?
I'm still kind of working on it. It's going to be really, really inexpensive considering the first one. So and I'll probably have payment plan like it's going to be 6 weeks, so people can work 6 weeks, but probably it's going to be kind of around this $400 to $600 mark for that whole time.
Okay.
Yeah, so it works out to be like $100 a week for the 2 live sessions, at least an hour, private sessions with me daily, being able to access me every day, that kind of thing. But I'm still kind of working on pricing. So like I said, it'll be like over the next month, I'll be putting that together. So
Perfect.
Yeah. I have a message here that I can't. Kim. Yes, absolutely. Yes. Okay. Different Kim. Okay. What I was going to say, oh yes, cranial work. So one of my favorite things to work on in my head after all this time is the space right here aside of the eyes. I love doing internal mouth work too on myself, but it's hard for me to speak that through. And one of the things I'll be doing when I do the course is I will have a guided recording of me guiding us through, so I can actually do it with you guys. But so I can actually guide you while I do this. In between these 2 areas here, this side and this side, is a bone way in there, kind of looks like a butterfly. It goes through the sinuses and behind the eyes, called the sphenoid bone. And working on this bone sometimes can really create relief with sinus pressure, even a headache pain, eye pain, even, well, I said sinuses, It's really a great technique to do. So I've modified it a little bit. When we work on patients, I just use my fingers and I'm going in, and I usually go back towards the back of the head and then towards the front of the head, and we hold each position very long. So remember, in this work, we're not forcing tissue. We're taking up the barrier and we hold it and we wait for like 5 minutes. So it takes a long time. But what I want to do, instead of doing just a finger, you can do a finger if you're comfortable with that. But I also like to use the palm of my hand, because I find that it's kind of fatiguing for people sometimes with their fingers. But if you can just do, you can see I've got my elbows, I'm sitting on the floor and using the sofa. But you can do this at a table, or if it's not uncomfortable for you to hold your hands there. But we're doing this for quite some time, right? So that's the thing, is that it's like, well, can you comfortably do it? So what you're going to do is let your palm and your hands just cradle your head. And you're taking that heel palm and gently pressing in. Now, you might actually know right away, and I encourage you to close your eyes. You might feel difference on one side than the other. And I always am, like, right side of my head feels completely different than the left. It's much tighter over here, but it just feels good to hold my head like this. And if you're, as long as you're relaxing your shoulders and your arms as much as you can, let that focus stay in that little sort of hollow sulcus area right behind your eye. And as you close your eyes, just imagine allowing yourself to fully arrive in your body here. Compressing in and staying steady. See if you can kind of even feel beyond your palm into your head. Imagine how your brain itself is between your hands. And yes, the bones do move. And you're also connecting in with all of the soft tissue between your hands, because when you give this gentle pressure, you're changing the pressure through the fascia on the structures within. So to be very simple about it, your eyes, your blood vessels, your nerves. We also have deeper structures in the brain, pineal gland, pituitary gland, hippocampus, all these little structures. Just stay consistent and constant with holding. And keeping that pressure centered, going toward the middle of your head. You may also now think of your hands, just think of it. Think of your hands going towards the front of your head, or towards your face, or towards your nose, whatever direction or words work for going forward. As soon as I did that, I could totally feel things shift, or feel a different pull deep inside my head. Allow yourself to be aware of what you're sensing here. Notice your breath. Long, slow, relaxed breathing. Feel your hands pressing and connecting. And take a moment now to also reach into a space of gratitude, being grateful for the function of your brain. When's the last time you even thought of that, right? The fact that you could click a link and get on a Zoom and talk and be here present with me, with us. Feeling the gratitude and joy of the amazing function of our brain. keeping your pressure constant. And you may actually start to feel things move. Just try to stay engaged with that pressure. Like you're constantly taking up the slack. Connected with your eyes. See if you can even imagine the eyeball in the socket. Feel it. And the gratitude and the love for your eyes. I feel that in my journey, so much of my life, it was very hard to find self-love, like it is for, I think, most people. And I would start with the eyes, find something about you that you love, and recognize it every day. Love your eyes. It's just a short sample of how long I would hold my head when I was trying to make a lasting change. But even here, I'm feeling some movement. We've been here about 7 minutes or so. So we need a good 5 minutes for the collagenous structures to start to change shape, to be able to get a new space of lasting position. And go ahead and slowly release your hands. And then I often like to take my palms to the bridge of my eyebrows and just connect in here as well. And you might feel your tissue kind of reach up. Your eyebrow might come up a little bit, but just let your forehead rest in your hands. This just feels so good to me. You're engaging that tissue in the very front. You ever wonder why we kind of have this innate desire to put our hand where we hurt? I believe it's because we have this ability to help ourselves. So engaging that, and just let your head sink into your palms to a place where it just feels good and it feels relieving. And then going into that space of feeling or imagining deep into the head. Relax your jaw, relax your tongue. Notice, does the tissue under one hand feel different than the other side? Feeling into that gratitude again, that joy and relief for your eyes, for your brain. Staying steady and gentle with your pressure, taking up the slack. It's kind of like you're watching tug of war. and one side starts to ease up and that rope starts to go to the ground, right? The other side, it's continuing to take up the slack. It's going to keep pulling a little bit more so that rope doesn't touch the ground. That's kind of what you're doing. If you start to feel the tissue move, you move with it so that you're continuing to take up the slack. This improves blood flow within and between and around the cells. And go ahead and release that. Okay. Anybody like how that feels and feel like they could keep doing it? No? Create space. Anybody feel anything they want to share? Everybody hit the wall. Who's going to hit the wall with me? All right. A few of you. Anybody want to share what it felt like to do the sphenoid one, the first one that we did while we're getting over here?
There's a lot of pressure.
Yeah, so did you try easing up?
Yeah.
And how did that feel?
I think it's a little better. Not as sure.
You definitely can use that work, Mom. And you can kind of even tell, you can even move this is very superficial, but you can put your fingers even on your scalp and move around and see if one side feels like it can move more than the other. That's that calm technique, right? We're connecting with our body, connecting, being you're aware and feeling, right? Assessing it, you can kind of feel. I also will grab my hair for those who can grab their hair and move things around. You can kind of see if things move. And a lot of times I'll do this on a patient and I can't move anything, doesn't move at all. And even on myself, there's been times where I've had trouble, and then I kind of work on that and loosen that tissue up. And then listening deeper, that's what we were doing, is we're holding that and feeling deeper into the body. That's kind of more of an intuitive sense. As John Barnes would say, channel 3, and the assessment is channel 5. So kind of just in our left brain, assessing things and then feeling more into it, more right-brained, right? And then M is allowing that tissue to move, or maybe even moving into another position. So for legs up the wall, I like to show people how I get to the wall, because I've seen people get to the wall so many different crazy ways, and then trying to scoot there and everything, it makes it difficult. So there we go. So I always sit next to the wall, just off to the side from where I'm going to end up being. So I have my arm next to the wall here, so I'm facing along the edge of the wall. To get to it, then I come down so that I'm perpendicular. I keep my head away from the wall, and I scoot my butt into a fetal position like so, okay? And then you're here, just kind of laying in a fetal position next to the wall. You just lay on your back, and then you're here, nice and easy. You guys can see me okay, right? And so if you get to the wall and your knees are bent like this, and it's uncomfortable and you're really feeling a lot of tension anywhere, then you just need to move away from the wall a little bit. And otherwise, you should be able to have your knees be straight. And you do have to actively hold them there for the most part, but it shouldn't be like killing you to be here, okay? And then you're going to bring your arms out to the side and reach and lengthen through your fingertips. So I think this is really a wonderful thing to do. I'm going to actually change this so I can see you guys better. I can see myself. So when you have your arms out to the side, we do so many things up close and in front all day long. When do we ever open this space? Nothing that we do functionally opens this area, right? So we're going to open this space and let the arms come out. Now check into your head, okay? We're assessing here again. If your head is tilted back like this and you can't lengthen it and bring your chin down and kind of be comfortable, then you just need to put something behind your head, like a rolled up towel or something, or not rolled, but folded, so that you're supported. And just let your arms sink into the floor here. Notice where you feel it. Now I like to assess here further. I pay attention to both of my legs. You might look up and see your ankle bones. Do they look like they're right next to each other, like those little points are ankle points? And if one seems higher toward the ceiling than the other, just kind of look into that. I'll even like reach my heels up and down, and kind of wiggle it out, and then look again. Let it rest where it wants to comfortably be. And sometimes when I do this, I can see, oh my goodness, my right ankle bone is like a half an inch closer to the floor. Well, I've got some tightness up in my body further. It's not my leg that's the problem, it's the pelvis probably, okay? So just take a notice of that, and then relax your legs. And then do you feel more tension in the back of one leg than the other? Or tune into your sit bone, or even your tailbone or your sacrum, the lower part of your spine, like between your butt cheeks. That's the sacrum area. Do you feel like one side of your back or your ribs are closer to the floor than the other? And you're just sort of assessing and feeling things. As you move up the spine, notice the shoulder blades. Does one shoulder blade feel like it's closer to the floor than another? Or is it feeling pretty even? Just being aware. And then tune into your hands. Open your hands up and spread your fingers apart. Even here, yes, we have fascia in our hands, and the tightness here wants to curl the fingers together. So open your fingers and gently reach and lengthen just to feel that tightness in the arms and upper body. So when I do this, I feel tightness in my hand and my wrist and my forearm, just because I do so much with my hands all day. But you might feel it somewhere else. So it could be anywhere, and everybody's different. So from here, you can actively lengthen for a while if you like, or you can just relax into it. And oftentimes I'll start out lengthening because I really feel some tightness in my chest, for example, or my arm or shoulder blade or whatever. And I want to actively change that. So I'm just holding that position. Just feels really good around my shoulders right now. I call these arm lengtheners. So I'm reaching from the fingertips, but you can also think of reaching now from the wrist or the elbow. And notice how it feels a little tiny different when you do that. I feel like the closer I get to the trunk of my body with my awareness, reaching with the upper arms now, it feels a little bit different. And I'm reaching my shoulder blades away from the spine. And I'm feeling that lengthening. And today I feel pretty good. I did a lot of self-treatment in bed this morning, doing these lengthening things that I do. And I worked through a lot of stuff this morning. This feels pretty good right now. But notice what you feel. And if you're getting tired in any position, or something is bugging you or starting to feel too much pull, you got to listen to that and move out of the position. That's the M in the calm technique. So let's let the legs go wide. So I started putting this whole series together when, oh gosh, it was shortly after I took my very extensive yoga instructor training in 2000, and started doing it with patients, and started refining these positions and the order in which I do them. So when I go wide now, one leg definitely feels different than the other, and you might notice that. And when we start to be aware of tightness in one side compared to the other, then we can focus on what we're feeling there and find different techniques. So like when I'm working with people doing a coaching program, coaching them through these things, it's like, okay, when you do your own self-care and you tell me, you know what, every time I do this one position, I'm feeling it over here in this leg and I don't feel it over here. Then we fine tune your plan for you so that we can get to that area, right? Now from here, let's just bend the knees. So the knees are wide. The feet are comfortably against the wall, but your knees are apart. So I'm actually going to take my arms and let my arms just rest on the inner thigh right here. And just that little extra weight, I can feel a difference in my right side, my right hip compared to my left, which makes sense because my right side is where I typically have more tension. My C-section scar on that right side really affects my hip. So I'm feeling that right now. It's not pain or anything, but I'm just aware of it. The problem is that we got so good at not listening to our body's whispers that we have to wait for it to scream at us before we actually do anything about it. So we really want to fine tune what we're feeling and what's going on. Tune in to the top of your head and imagine lengthening the top of your head away from the spine and notice, or away from the wall. What does that do to what you feel? So I just adjusted my shoulder blades down and kind of reaching my shoulder blades now toward the wall a little bit. And then relaxing into that. So you'll notice in each of these positions, it pulls into the body a little bit different, getting into other areas, even though they might look similar. So from here, if I go into bringing the bottoms of the feet together into more of a butterfly position, now your feet might be up higher on the wall, or you can bring them down closer toward the floor. You can have your arms resting on the inner thigh, or you might want your arms down on the floor still. Whatever feels good to you. I need mine here on the legs. I'm quite tight right now. Now I'm going to work on my wrist. So if I have my arm here on my leg, I'm going to open my fingers. Open your fingers. See what that feels like when you stretch open your palm. And then bend your wrist back. So you're opening the front of the wrist and the forearm. And notice, how does that feel? You know, we're using our fingers all day long and we're doing what's called flexion movement. And rarely do we do anything functionally that opens our hands like this. So this is giving that part of our body an opportunity to go in the other direction. I love using the idea that, you know, if we moved every joint in our body, its full range of motion that's available, normally every day of our life, barring any injury, we would have that full range of motion, but we just don't do that. We don't like our hands can open this far, our wrists can extend back, but do we do that every day? Probably not, right? But this helps to remind the body that it has that available. Now I'm going to take my left leg and bring it up. I'm going to cross that right leg over the other so that my ankle is not pressing my knee, but it's on the thigh. And if that's too difficult for you to do, you just place the foot on the wall. So now one leg is straight and the other leg is next to the straight leg. The foot is next to the straight leg. But I'm going to put it up on my thigh here. And then you can take your hand to your knee that's bent and bring it into your body. You might notice that you feel it in a different place when you come toward the center, or if you push that knee away towards the wall. Now you can try kind of pick, what do you need more of today? I need it to come in, I think, towards me today. So I'm going to hold my knee here. I'm not holding these positions very long today. And sometimes I only have 10 minutes to get to the wall. And so I would go through each one of these fairly quickly, but I might find one of them that I'll hang out in for a little longer. And then the next time I go to the wall, I may spend longer in a different one or in all of them, depending on what time I have. I'm going to think back into my body and lengthen my head away from the wall again. Notice what that does. Think of your tailbone and think of reaching your tailbone toward the wall. Now let's try the other side. Taking the left leg, crossing it over the right. Push your knee toward the wall, push your knee toward the center of the body. And does it feel different on this side compared to the other side? Most people notice that their legs are not exactly the same, right? So just tune into that. On this side, I can actually bend my straight leg a little bit and bring that leg closer to my body, get a little deeper. I'm going to bring my arms back out to the side and open my hands and lengthen. I like this position a lot because I get a lot of tension in my arms from having my arms in front of me most of the day when I'm working or driving. You know, we do a lot of driving. We're looking at our phones or even cooking or anything we do. So much of what we do is forward. This gives us a chance to open that up. And then release that leg. Let's go back to the center position. Notice what you feel like now. Some of you may be like, oh my gosh, I'm ready to get away from the wall. Well, we just have a couple more. We're gonna bend the knees so that the feet are close to each other, but the knees are just bent. And then what I like to do is walk my feet. So watch how I do this. I keep my shoulders on the floor, keep your arms out to the side, and I'm gonna walk my feet on the wall over to the left. Little baby steps, walk, walk, walk. Now, you might find you need to stop right here, and that's fine. What I like to do is bring my hand over if I'm going to stop, and I support my knee with my arm on the left. I'm going to the left, so I take my left arm and my left hand and support my knee. I'm going to turn my head to the right now. It's like you're twisting your body out, like you're twisting out a washcloth, you know? Keep that right shoulder on the ground because when you twist to the left with your knees, if you have tightness in your spine or your ribs or your trunk or anywhere there, your right shoulder is going to want to come up. So think of your right shoulder blade going into the floor. Now, this is my tight side, so my right knee does not want to go down anymore, and that's okay. I'm just kind of feeling all of that on my rib area and my spine, but that's where I feel it. So you may feel it somewhere else. We all have unique fascial restriction patterns. So that's something to keep in mind. There's no like particular place where you should feel this or should feel that. It just depends on what your history is and what's showing up in your body. And the more you're listening to that and feeling into that, it helps you because then we can address it in other ways. So now we're going to twist to the other side. So gently walk your feet, little baby steps over, over, over. To the right, turn your head to the left. Keep the left shoulder down. And this side, I can go further. So I'm just going to let my knees go down over there. And breathe into it. Notice where you're feeling it. Never push anything. Remember, we don't force, we don't force the body. And if there's something that's uncomfortable, we just come out of it. Maybe we try it again. Maybe we can only do, 15, 20 seconds today, gradually adding more as our body adapts, because your body is going to adapt to whatever you do and whatever you don't do. Oh, so we're going to come back up to center. And I'm not going to do the last position just because it's a little bit more involved and it's something that I add later on when we do an actual series of legs up the wall. But notice when you bring your legs back up to the center, does it feel different? And wow, I can feel a big difference even with just that little bit. My buttocks are closer to the floor and actually a little closer to the wall. It just feels different for sure. Oh, and one more thing I want to have you guys try is laying on your belly for just a few minutes. So if you're game for this, come away from the wall, and I come away just enough. If you can go completely far away, or you might be able to be close enough to have your feet bent like this. This is going to pull more into the front body if your knees are bent. So your legs are on the wall, but in a completely different way, right? So, we talk about babies getting tummy time, but adults need it too, especially the older we get. It's amazing to me how many people I see. I'll say, do you get on the floor? How often do you get on the floor? How often do you get on your belly, right? And so many times I hear, well, I never do that, or it's too uncomfortable, or I can't do it, that kind of a thing. So if you can't get to your belly easily or often, start doing it a little bit every day. Even if in bed, before you get out of bed, you roll over to your belly and be there for a few breaths and then get up. Like, let your body get used to doing that, because this area here in front of your hips, it gets tight in there when we sit a lot, right? So if you're basically sitting for the most part, and you go to sleep, most people don't sleep flat on their back with their hips open, right? They sit on their side in a fetal position. Well, what position is your hip? It's bent. So this is really opening that area, and you can just rest your forehead on your hands like so. Or if it feels good to you, you can come up on your elbows. So when I come up on my elbows, it feels so good in my C-section scar, like this whole area, it's cut twice, right? And there's a lot of scar tissue in there, and we don't talk about it much in medicine, but it's the outside scar might look fine, but it's what's going on the inside. And I feel this pull into my sacrum every day. If I tune into it, I can feel it there. So when I'm here, this actually feels so good. It feels like relieving it, or kind of like when you scratch an itch, you know what I mean? It just feels really good. So you don't have to be up on your elbows. You may feel compression in the low back here. Just listen to your body. Be here, even if you're here for just a little bit. It's really good thing to do, and it will improve your strength too, your bed mobility. So I'm going to come away from the wall and come back up to sitting. And we've been on here a long time, so I would generally take longer and have you kind of go through some more breathing and relaxation and whatever, but I'm going to close this part for now. Ask you guys to unmute and get my glasses. Who does legs up the wall? I know some of you do. Yeah. Awesome. How was that? Hey, Jan. Good to see you.
You as well. I was glad I could make it.
Yeah. Good to see you. Thank you, guys. Oh, what was that?
I do legs up the wall every day. It really helps my lower back. So.
Oh, that's awesome. Yay.
Yep.
I've been giving this to people for so many, 25 years. And the people who come back and are like, I do that all the time and it really helps. I mean, I see it change people,
Mm-hmm.
It's funny when I don't know how many times this has happened. I see somebody, I've seen them at the mall, the grocery, whatever. Haven't seen these people in years. And they're like, I'm still doing that. It's a great thing. So thank you, guys. Does anybody else want to chat or say anything before I close up? I really appreciate you showing up for me and experiencing this and spreading the word.
Happy birthday. Happy birthday, Cindy.
Thank you
Thanks
so
for doing
much.
this.
Happy birthday, Cindy.
Thank
For sharing.
Yeah, thank you, Cindy. It was wonderful.
With us.
Yeah. So should we do it? Should we bring back virtual self-care classes? What do you guys think? Yes. Right, we'll be having these too. I think it's fun just to pop on here. I'd like to do it more often. Just a free class. Just join me, do it together. It's so good for our bodies and just to bring in that self-love and caring for this incredible vehicle that we get to be here on Earth School in. So it's taken me a lot of years to learn how to truly love it, but I'm grateful for this body. And I got to say, like through this past year, especially last few years, oftentimes I would say, well, it could be worse, be grateful. And in some ways it's kind of a negative tinge to it, but you know what? It helped me be more positive and more upbeat. So it works. Anyway, thanks again, you guys.
Happy birthday.
Thank
Happy
you.
Birthday. Thanks, Cindy.
Thanks so much for watching and being a part of my day. Please like and subscribe and share Essential Therapies with those you think it may benefit. And remember, you are creating tomorrow's body today.